everybody, I'm Namita Thapar, Executive Director of MCure Pharmaceuticals, and today we're going to talk about a super interesting topic, egg freezing. As always, let me start with a shocking statistic. Did you know that a woman loses 90% of her eggs by the age of 30 and 97% of her eggs by age 40? I know this is a very scary statistic. All the more reason why women in their late 20s, early 30s should consider getting their eggs retrieved, get them frozen and use them later when they're ready for their pregnancy. Let me introduce my dear friend Hrishikesh Pai.
Hi.
Dr. Pai, thank you so much for joining us. And Dr. Nandita, two lovely doctors who do this for a living. And Vandana, thank you so much for being here and sharing your story with us.
My pleasure.
Let's start with the very basics. What's the right age to get your eggs retrieved and eggs frozen?
I think, as you said before, 90% goes. So 25 to 35. The later, the better it is. I mean, 27, 28, because 25 is too young. But before 35, definitely.
That's a good age that women should keep in mind.
Yeah. But Namita, we get patients between 35 to 40 also.
Right.
Because for them, that's the only option. Okay. So I think we don't have a cutoff as such. But ideal age, yes. Late 20s and early 30s.
And what is the process? It just sounds so intimidating and painful because people tell you about those multiple injections you have to take. Just in brief, in layman terms, Dr. Pai, why don't you just quickly tell us what is the process?
So basically, once a person wants to freeze her eggs, we would analyze her and investigate her, see her ovarian reserve. So normally we do an antral follicular count and we do anti-Mullerian hormone test.
Correct.
And to see what is the reserve. And after that we stimulate her. So normally they take about 10 or 11 injections. Nowadays they are very painless because they are under the skin, just like insulin injection.
Can you self-inject or do you go to a doctor?
No, you can even self-inject. We monitor them and once they are ready, we admit them for a oocyte retrieval. It takes just about 10 minutes. We give a short anesthesia and within 4-5 hours they can go back home.
So the entire process, the 10 to 12 injections is over 12 days plus one more day for the retrieval. So you're talking about a 2-week window for the process to go on.
Right.
And are there any side effects? So after taking these injections and after the retrieval, is it that she can, like next day go back to gymming and working or not really? Like what does she need to know in terms of side effects?
There's not really much of side effects. Sometimes like with any surgery, you can have a complication, but that's very rare. So I don't think there's any side effects. Only thing she needs to be careful because after the ritual, the ovaries are a little enlarged and heavy. So a little bit of a slightly lower level of activity and then you resume your work.
You can go back to work.
Yeah.
Tell me, Dr. Nanda, what is the typical cost? Is this something that's very prohibitive or is it covered by insurance and EMIs? How does it work? Because women need to know this. Women basically need to know everything before they make this decision.
I think first, let me say it's a very patient-friendly treatment, okay? And the cost is variable. Anything from 70,000 to even 3 lakhs. There are companies who are actually freezing eggs for their young employees so that they can work and not worry about childbearing. The insurance sector in our country right now has become very, active, and they are creating packages because obviously they have to go through the actuaries and all those finance terms which and they will prepare it and they are coming up with the things. Of course, there are EMI schemes also which are available.
But see, this is the cost of one cycle of 14 days. One related question I wanted to ask you is when you give the injections, stimulate the ovaries, you may not have enough eggs, right? And you may have to repeat the cycle for 14 more days. So I guess there are two questions. One is how many eggs are enough eggs? Like what is the optimum number to get and store? And what is a cutoff where you say, okay, you'll have to do this a second time, we don't have enough eggs?
It's all age related, and of course your ovarian reserve. As you said, Indian girls, get a menopause 7 years earlier. The aging starts much earlier. So 10 to 15 eggs when you're under 30 would be a good. 35, I like 15 to 20 eggs. We may both differ on that. But I think as you grow older, you need more eggs. See, there are fertile women also who've had a divorce, who've been widowed, or they've had their second marriage and they want to do it. So I think, this is a technology which empowers girls.
So bottom line is 15 to 20 eggs is your optimum number.
If she's under the age of 35.
Per cycle.
Okay, per cycle. You differ?
Yeah, no. Mine is target is 10 to 12.
Putting him on the spot.
10 to 12 eggs, but like we have a new program, artificial intelligence. So after the eggs are taken out, we take the photograph and export it to a server abroad, and the server tells you whether these eggs are good enough for a pregnancy in the future.
That's a good point. You know why? Because it's not just the quantity, it's the quality of eggs.
Yeah.
How do they check on the quality of the eggs?
No, so the only way is the number and the age.
Okay,
Age
so there's
and
no
the
other
number.
way to
There's
really
no other
check
way.
the quality.
You can have a look at the eggs and all, but the age and the number is the only predictors, and that's why 10, 12 eggs, in her dictionary it is 15 eggs plus. Mine is 10, 12, but that's
about the range that you're talking
There was
about.
one more
15,
question you asked about repeated cycles. So
Yes.
in our group now, because it's not the money that we are looking at, it's giving a service. So if a person has less eggs, we'll do a second cycle at cost price.
Understood.
And we don't recharge for freezing also.
We don't.
Understood.
So we accumulate the number of eggs because that's where the problem is.
Yeah, I mean, of course, in this case, the more the better. Then why is it that when, a lot of single women or even, married women who want to delay their pregnancy are told that, hey, why don't you freeze your eggs? Why do they get offended even now? Why is it still something that's a taboo in our country?
The generation which is there now, they don't want to talk about childbearing. They want to have fun. They want to enjoy their life. So they are not very keen on it. And they feel that we are not infertile. See, that's what needs to be clarified, that you're not infertile, but there is a high chance that you'll face difficulty later on.
Yeah.
So you have to balance it out. You can't do it too early.
Right.
Because many times what happens then, it is a waste of resource because many of
That's
these
also
people are
true.
going to become pregnant spontaneously.
Right.
So you have to do it balanced. So 30 to 35 would be a good time to do it. If at all you feel that you're not going to get married or you are not going to meet the right guy,
Or you want
before
to
the age of 35, or you just want
to delay because of career
exactly.
issues.
career issues.
Career
Exactly.
So then in those cases, you should freeze them.
Absolutely.
But Namita, we are seeing a lot of young girls, 25 to 30 with low AMH. AMH is, as he mentioned...
What is the reason why is with the new generation the AMH depleting? AMH is basically your ovarian reserve.
Exactly. So I personally feel it could be, there is a genetic component to it. Then there is something called the environment. The environment toxins are causing that. It's causing accelerated aging. We have so much contaminated food with pesticides and all those. So the environmental factors are affecting this.
That's why you need to do an AMH as a routine screening test.
Oh yeah, that's a good point. Make it part of your annual blood test.
Checkup.
Annual blood test. AMH helps you understand your ovarian reserve, which is the quantity and quality of your eggs, basically. Now a controversial question. Storage of these eggs. I don't know, it's me or a lot of women talk about, lekin, theft ho gaya, swap ho gaya, hamara eggs. Does it happen?
So now we have got a lot of systems in place wherein, you can actually now tag the eggs with radio frequency tags. So there is no
like
question
RFID.
RFID, no question of swapping the eggs. And we also have now new regulations where we have to lock the room where the eggs are stored. It has to be monitored properly. So the chances of anyone stealing it is not
I don't know. You hear these sensational YouTube videos of eggs stolen and eggs swapped, and you're like, is this my baby?
That is why the country has come out with the ART regulation law.
Okay.
And now
that's a
everything is
helpful point.
so everything is monitored now. We have to document everything properly, and we have to be qualified, and there is inspections, etc.
So ART stands for artificial reproductive techniques,
or
right? Technology. And that basically covers infertility procedures, and that is a very good way to just have that healthy fear in people not to do the scams. How long can these eggs be stored, doctor? How many years till they're fresh and can be used?
Till the temperature is maintained at 196 degrees, minus 196 degrees, they will be maintained. So you can really
For years and
5
years.
years, 10
Oh,
years,
10
15
years.
years.
Okay.
We've had a patient who came back after 15 years of freezing, embryos of course, but all our patients
be done after menopause?
We have
Can it-
given up babies to people after 10 years of freezing and all.
Yeah.
the embryo.
Oh.
So
Can it be
egg
done
freezing technically,
after menopause?
Sure.
Can you do it
It can be
after
done after
pregnancy,
menopause.
yes.
No,
Yes.
we have to do the freezing beforehand.
No, the pregnancy, of
Yeah,
course.
obviously. Yeah.
But the cutoff age is 50 now by the law.
Oh, is it?
Yes.
So I think that's a very important point you've brought out, that for any infertility
For women, it's
procedure,
50. For men, it's 55.
of course.
Yes.
Always.
I was just gonna-
Always.
Always.
Better numbers for the men. But let's move on to Vandana.
Hi.
Vandana, I'd love to hear your story. Thank you for being with us
They are
today.
my magic hands, I call
Your
them.
magicians.
My absolute magicians. I got married late. I was working. So that obviously takes a lot of your time as an actor. I was also taking care of my siblings and my parents. So it was a lot of responsibility single-handedly on my shoulders. So this happened. I married at 35 and I was lucky that I had, I got pregnant the first month of marriage. I was like a jackpot, you know, you just get married and next month you miss your periods. And but unfortunately I had a miscarriage on my 5th month, and I had back-to-back 3 miscarriages at 35, 36, 37. And I stopped working and I said I want to really give this, you know. And I forget about egg freezing, you know, Namita. It wasn't, even IVF was not something that people were so open about. Even my own husband, when I told him like let's think of IVF, he's like, why? We are normal. But with a lot of, finally, I got my husband to meet Dr. Pai, and you know they had a conversation. And we got down to taking that step. So at 45, it was a shock to my family, friends, doctors, science, everybody, and they're like, "Who did it?" So I said, "Well, destiny, my manifestation first, and then of course
The right people guiding
right
you.
people, you
How
know?
many cycles did you go through
I went
before?
through 3 to 4 IVF cycles.
3 to 4 cycles before you had success, and
Yes.
that's where you wish you had frozen your eggs and you
where-
had that information
Yes,
earlier.
Yes, yes. My entire thing was about I wanted to be a mother. I wanted to have a baby. I tried surrogacy, that also failed. But finally, when this happened, I applied, and the next month, I went for a cycle and I
Right.
got a jackpot. It was
Right.
twins. I lost one. I had to get my baby out in the 6th month, and so this is what happened. And all this would have not happened, you know, if I would have frozen my eggs and I wouldn't go through so many cycles.
Right.
I wouldn't have that, but I still
And
remember.
probably an easier pregnancy too.
Yeah, and I still remember when I used to make my embryos and save it and keep it. Coming back to EMH, the embryos that were recent were not really working.
Okay.
But 1 or 2 which I had kept it earlier, like my first cycle, that kind of helped working. So age really makes a difference.
Absolutely.
Yeah.
No, this is fantastic. I mean, so much information for our audience to really think through, and end of another fabulous episode. But the one thing I want to leave all of you with is egg freezing has to be done. Get your AMH checked every year. Women, there is something called a time or a biological clock. Become aware, don't be in denial, don't judge, don't shame, support, educate, and let's get those eggs frozen sooner rather than later. Thank you.
बनके उड़ना है फिर